Well, as concerns mount over stricter restrictions in the coming days, some experts are urging government to relax COVID-19 regulations. One economist believes that the impact will be more devastating to the economy, business and workers. Let's speak to that economist now, Duma Gqubule, joining us live. Duma, thanks for your time. We appreciate it. So you reckon there are other ways for government to actually deal with this situation?
Yes, I think people mustn't casually say that we must have another hard lockdown. The last lockdown was devastating. In 6 months, we wiped out all the jobs that were created over 12 years. And by the end of September 2020, there were less people employed than there were in December 2008. Many people went hungry. And so I just think we can't be talking about another lockdown, because what it's forced us to do now is to revise all our economic growth forecasts for this year. And the numbers in the budget are irrelevant because we can't go through another cycle of lockdown, easing, new surges and another lockdown. And it's going to cause havoc to our economy. And I just think that we should be thinking about after a year, we've learned so much from other countries in the world about what we need to do to control this virus.
But other countries are actually going back into hard lockdowns, right? The UK announcing it, Zimbabwe, other parts of the world as well. But you say there are alternatives to these measures that government can consider. What are those alternatives?
Okay, so the government, the countries that are going back into lockdowns are the ones that were the most, they failed public health responses. So the first one I would like to talk about, the first technology that people have been talking about, Paul Romer, the Nobel Prize economist, Mariana Mazzucato, is universal testing. So what that means is that we test everybody tests every 2 weeks, and you test and you isolate the people, so you lock down only the people who are infected. So I can now go, it's happening in many companies throughout the world, in many universities in the United States. So people go around their normal business. You can go to the library at the university, you can go to the company, and you know that everybody is tested negative. So that's the first thing. And in Asia, South Korea is having a third wave, but the numbers are very low. So what they've done is that they have this thing with contact excessive testing as well. The results come out in 6 hours, their PCR test, and people are encouraged to isolate and quarantine. They go after all the contacts of the people who were tested. If you test positive, the government goes and tracks down all your contacts. For example, there was a march in South Korea in August with 35,000 people, anti-government rally. People didn't do the social distancing that they were supposed to do, and there were massive infections. So the government tracked down all the people that went to that march, and they got and they went and they tested the people and they encouraged them to quarantine and isolate. So and the third one is obviously the vaccine. And I actually don't understand. I've listened to the government's response, and I still don't understand what is the delay, because in my book there's no financial constraint that is preventing government from purchasing these vaccines. So I actually right now don't quite understand what is. There can be logistical and distributional constraints, but there is definitely no financial constraint.
Yeah. So this delayed response in terms of the vaccine, and government, of course, would say it's not delayed because they've been in talks with the relevant people since October last year. This delay in getting the vaccine to South Africans overall, what are the consequences of that on our economy?
It means another year of, so most economists were predicting a recovery for this year, and they'll have to redo their forecast as they get back to work next week, because we could have another cycle of lockdown, another lockdown in June, another lockdown in December, because unless we take a grip of this pandemic, we can't go through these repeated cycles of lockdown, easing, new surges, and lockdown again. So we have to find another way to have effective public health measures. And the key is, Shahan, is excessive testing throughout society, because the universal testing, it's got an advantage because it picks up also your asymptomatic carriers. And so the government should have, during the so-called quiet period before November, like last quarter of last year, been purchasing these rapid test kits. I understand that they've been used at the border for people coming back into South Africa. So we do have some of these rapid test kits, and I do think maybe we should procure much more than we have at the moment here.
What is government not seeing actually happen properly to our economy for them to be making these decisions? Do you think they're overlooking a lot, or are they focusing on one thing specifically and not the broader picture?
I think the government and the advisory council are focusing on one thing only. Look, half my family is from the Eastern Cape, Port Elizabeth. I was amazed because the numbers in the Eastern Cape weren't that high in terms of daily infections, but I couldn't understand why the government couldn't get this thing under control by, tracing. You have to find the people who are infected. You have to find all their contacts. You have to find the places where there were things, and then you go and test those people who were the contacts of the people. Yeah. So I couldn't understand why they're struggling. We should have employed, Shahan, I believe, a lot of community health workers. The community health workers in the communities, they can go out and places like taxi ranks, explain to people why they need to ventilate the taxis, ventilate the spaza shops, and explain. So you can't just go with the police and expect them people to comply. You have to also have lots of community health workers, people who are going to go into the communities and who are also going to find people who are infected in those communities and get them to test. We should also have been providing incentives for people to isolate. Some people can't afford to isolate and they go to work when they know that they're infected because they can't afford it. So we should also provide incentives for people to isolate and quarantine. And something as even like a grant. We had grants and they must get grants, just like we had the grants for the SRD grants. So those are some of the desperate measures that we should have considered, because the cost of the things that I'm talking about, they're far less than the cost of this lockdown. The lockdown will cause an unprecedented depression in our economy that we will not recover from.
Yeah. So let's talk about the PPE corruption and the actual impact that has had in government's response to this virus and the second wave. How much of an impact do you think it's had?
It was quite amazing because the first thing we saw was the food parcels, and the money that was allocated to the food parcels, it was so little. I was on a panel discussion with eNCA Suleiman, Gift of the Givers, and I was actually shocked that he had distributed as many food parcels as the whole of the government put together. But the little food parcels that were delivered, that was abused by many people to make profit out of it. Then we saw it with the PPE tenders, and that is what the Auditor General's report was talking about. I think the figure was about 2 billion rands. And I just think that and then obviously, those are the type of things that I read about. And obviously the TERS money in terms of the UIF. But I must say, although a lot of the money of the TERS, the 55 billion rand that was spent to people who were temporarily employed, and a lot of it went to people who needed the money, and some of it obviously was abused as well. But I just think that it's also, I think, you can't be announcing a lockdown tomorrow, the government, without announcing measures to the stimulus measures to provide support to people, because the support measures, one of the painful things that I've seen during this pandemic is the millions of people who are queuing outside post offices every day. Now, you're announcing a lockdown, but at the end of January, you're going to withdraw that kind of support to the people. I don't think we should do that. So if the government is going to announce a lockdown, they should announce at the same time some kind of income support to the people who are affected. Because with the measures that have been announced last week, I've already seen businesses in my area shut down, and restaurants and so forth. And there's no support for people who are affected by this lockdown.
All right, thank you so much for your time. We appreciate it. Economist Duma Gqubule.